We have seen reports of deaths, sudden cardiac deaths in Hassan district of Karnataka. Recently, 21 or 22, more than 20 people have passed away, and all are below 40 years of age, and the reasons are not yet analyzed. And not only in Karnataka, we are finding daily in everywhere, all over the world, around us in Kerala and Tamil Nadu, North India, everywhere people are dying. That too, people below 55 years are dying, sudden cardiac deaths. And we are
not
also,
only deaths, morbidity also have increased so much.
So what is observed as common in these people as is that they are healthy. Most of them are healthy. They were healthy. They were not taking any drugs or anything for. That's what the reports say, though we don't know. And they are in a very highly productive age group. They are needed by the country, and they are suddenly dying or suddenly getting sick.
Even school children. While playing.
They were not having any sort of ailments before. All of a sudden death is happening, or all of a sudden a serious health problem is emerging. So definitely being medical practitioners of a different system, but the system of healing man. I think it's our responsibility, even though vaccine or something is an
Western medical system.
Is an invention of Western medical science. Every medical science physicians have the right and role in doing independent research and analysis in the science of this
and work for
experimental. So this experimental vaccine, COVID-19 vaccine, was introduced as emergency authorization by regulatory agencies by considering it as a crisis. Emergency authorization was done. So there was no long-term safety studies or anything done. So I think it's appropriate in this period to have a logical reasoning and logical discussion regarding various aspects of possible side effects and complications caused by this experimental toxins in the body, right?
Yeah. They will be analyzing the risk factors only, because they don't have the causation. They don't know the relation with, or they haven't learned the physiology or biology in relation with life, regimen, lifestyle, or food, medicated water, or other things. So they don't know the relation exactly how the physiology is getting altered.
So I would like to interrupt here once again. It is shown that late gadolinium enhancement is visible in the cardiac MRI of the many patients in autopsy. Their cardiac MRI of the heart, showed late gadolinium enhancement, which indicates myocardial scarring or injury. 81% of vaccinated individuals, the research says, they are showing this LGE, which is called late gadolinium enhancement in their autopsy cardiac MRI. So, which significantly means that cardiac deaths, cardiac pathologies, arrhythmia, left ventricular failure, other pathologies, everything is emerging out of it.
Their studies are based on their prior knowledge, which they have is related to risk factors only. Risk factors, it produces likelihood of producing a disease. It will not be a causative factor. So for them, the risk factors are diabetes mellitus, or hypertension, or dyslipidemia, which is the most important cause, stress, or their lifestyle, like saturated fat, whether they are consuming or not. All these causing dyslipidemia, or deposition of cholesterol or triglyceride, resulting in the development of atherosclerosis followed by myocardial infarction or heart attack. But these risk factors can never be the causation, and the research outcome will never be conclusive, because all these are risk factors.
And one thing is that the investigation is not starting from a common thing which they have undergone, which is the experimental cocktail vaccine. So if a common thing which happened in all these individuals should be the starting point of research.
Yeah.
So that only identifiable thing.
That's what I told. They don't have such a study before. So they will be analyzing only the risk factors.
Yeah.
So one or other person will be having one or other risk factor in them.
Yeah.
So they will
Which
be having
is
a
not
family,
common.
which is not common.
Yeah.
But they will be having a family history, or they will be having some sort of stress. Stress
Right.
will not be that much assessed.
Cigarette smoking.
It's according to the subject what
Right.
he is saying.
Right. Impact will be variable.
Variable.
Yeah. And also this vaccine, there is direct evidence to prove that two things in the vaccine, lipid nanoparticle and spike protein.
Yeah.
Both of these, lipid nanoparticles definitely can induce more and more spike proteins, and there is clear evidence of presence of spike proteins in various tissues of the body, including heart. And also these spike proteins definitely can trigger inflammation.
Yeah.
And it is immune mediated. So inflammation can happen in any part of the body, and this can also cause endothelial injury. Direct evidence is there that spike protein is causing endothelial injury. So these are all scientific studies, studies which are proven in Western science. So why they are not able to bring these scientific studies to the deaths which we are finding?
So they
cardiac
need
deaths.
to differentiate between whether it is because of COVID or because of COVID vaccine.
Yeah.
So the studies should be mainly focused on that itself.
Yeah.
If it is due to COVID, so its inflammation will persist for some months, or it may result for few weeks.
Yeah.
So once when you are investigating whether it is due to inflammation is due to COVID,
Virus or cold.
virus or vaccine. So when we check for virus, we can easily find out that whether it's caused by virus itself. So they should find this spike protein or other virus-related factors in the inflammation. Once this virus protein dissolves or disintegrates, then that inflammation will not persist in COVID.
Natural infection.
COVID-19 related long inflammation. If it is due to vaccine, that it can affect in different ways according to Ayurvedic science, according to the scientific principles of Ayurveda. There are so many ways with which this will be acting as a toxin, because the spike protein, which is like an antigen, it evokes antibody response.
Yeah.
So whatever that makes the body respond is harmful to the body, because it's a harmful thing. That's why antibodies are produced.
Right.
So it acts like a toxin.
Right.
So it is mentioned as Dehathadu Pratinika Bhuta Dravya. So that Dehathadu Pratinika Bhuta Dravya, or this toxin, can produce effects in different ways.
Yeah.
It is not in a single manner. It can directly produce immediate effects also, acute diseases or acute fatality. It can initiate chronic diseases. It can cause chronic fatality or chronic death, means after a period that can result in death. Or late effects. Late effects can be directly by this toxin, or it can evoke some causative factors which will remain in tissues for long period, and it can cause several other conditions like serious diseases can develop, or intermittent fever can develop, or it can cause altered immune response.
And the worst thing is that avipakitvat chirakleshakarija, it is directly mentioned. Evidence is there in Ayurveda that any kind of toxin, because it is avipakitvat,
it cannot
be metabolized. Chirakleshakarija, it can produce prolonged toxic effects in the body.
So easiest way is to check whether it is due to COVID, that long inflammation is happening, or long COVID, they tell that it is long COVID. So it's not long COVID. So COVID is by a protein which gets metabolized or which gets disintegrated after a period. So if that is not there, then it is not due to COVID. That inflammatory condition persists because of wrong treatment. Wrong treatment, if done, it can cause metabolic disorders, it can cause immune dysfunction. So either because of wrong treatment or because of vaccine. So when vaccine is there, in our science it is told that rasam vipagasto viryam prabhavastan vyapohati. So if something is having prabhava, COVID virus will be having virya, but vaccine is having prabhava. It will definitely act on the targets. So if it is affecting the immune system, so many altered immunity or cancers can develop. If it is affecting the vital organs, it will be definitely having affinity towards vital organs.
So you mean to say that there are two kinds of impact. One, direct impact as a toxin. It can cause direct impact and chronic.
In two ways. Immediate direct effect, immediate indirect effect, late direct effect, and late indirect effect.
So it can adversely impact the immune system, and the spike protein being a foreign body, it can trigger abnormal immune activities.
Yes.
If it is happening in the myocardium, it is myocarditis. If it is happening in any other tissues, their inflammation will be generated.
Endothelial injury can
happen.
So
Also.
Hypercoagulable state can develop.
It is immune thromboembolism, immune mediated. So definitely a person who is vaccinated, once he is getting a flu, even a viral infection, he has to be, that immune activation is happening. So he has to be very careful to get rid of the infection as early as possible. If he is doing some sort of adjustments, immune suppression or any fever suppressant, it can adversely impact his immune system and generate a hypersensitivity reaction, which can cause immediate heart attack or cardiac arrest. Am I right?
Yeah. So after COVID, many have taken vaccine. So they cannot distinguish between whether it has caused by this COVID or by vaccine. And many have taken, after taking vaccine, many have developed COVID infection also. There also it is a bit confusing. But the best method is test for this COVID proteins or this antigen in the subject where he develops any sort of disease, metabolic or whatever be the disease, find out this COVID related factor in that or vaccine related factor.
How to find out that?
Means vaccine content should be checked. These nanoparticles we cannot find out.
Spike protein is
may not be metabolizing. If it is not COVID related, then it is definitely due to in a previously healthy person. Vaccines were given without considering anything. Immunocompromised people were given, altered immune people were given.
That's another thing, no? People who are healthy, people who are pregnant, people who are lactating, people who have one disease, two disease, three diseases, one suppressant, two suppressant, three suppressant, six suppressants. All these people are given a universally one experimental intervention. They have undergone. So what kind of impact, positive or negative impact, will be caused by this thing which is injected into their deltoid muscle? People are of variable kinds. Their immune system is variable, digestive power is variable, efficiency of detoxifying tissues and organs are variable, interaction between different systems are variable, internal drainage mechanisms variable, interaction of medications which they are taking is variable. Then how they are telling that?
Only when their immune system is healthy, only they will be developing this immunity.
Antibodies, healthy antibodies.
Healthy antibodies.
So where is the question of emerging healthy antibodies in people who are undergoing these kind of diseases and treatments together, like in all from all systems?
In such people, when such thing is introduced, when vaccinated, that process becomes faster. Already they will be having some susceptibility or they will be having some pre-morbid status. All those diseases get aggravated. Also, when there is susceptibility and when this poison or this toxin is introduced, they will definitely develop that disease. So, sudden development of diabetes, sudden development of hypertension,
worsening also,
kidney diseases,
cancers,
so many types of cancers,
turbo cancers,
that too quickly progressing. So, how they can tell that it is not due to vaccine?
So, it is also mentioned that in our science, dhatu pratiniga bhudani dravyani deha dhadubir virodham abhadyante kanijit samyogad sometimes by combination, kanijit samskarat, kala, desha kalat, kanijit swabhavat, sometimes by the very nature of the toxin itself.
In that individual.
In that individual,
Yeah.
it can vary. So there are several factors which determine the immediate and delayed effects and side effects and undesirable effects of
what
this.
they tell is idiosyncrasy. Idiosyncrasy means it varies from individual to individual.
Yeah.
So in Ayurvedic science, everything is very well told, in which all individuals are prone to get diseases, or who all are having good resistance,
Right.
who all can prevent such immediate effect, or they can
Latent
develop
effects. Yeah.
So tadev hi apatyam deshakala samyoga virya pramana adiyoga. So sometimes when the climate changes, only that effect comes, or when they go to another place, that effect starts coming, and at that time they develop a disease and it progresses very fast. Or when the food habits change, or unwholesome food is consumed, or those who are alcoholics, when they take alcohol itself, it gets aggravated, triggered. So it is not that immediately after vaccine it should develop.
But this is regarding the later side effects. I have seen that this is not going to produce side effects after 2 months.
Yeah.
Some videos I have seen. So congratulations, 2 months are crossed. You will not get any side effects now by COVID vaccine because it will be disintegrated in the body. What do they mean by this disintegration? Because already when an adverse impact in the immune system is produced, when an adverse impact in the body is already produced, after it disintegrates also, immune system is getting altered.
Yeah, once
So
that pathology has started, then if that cause is not there also, the pathology will progress.
It will escalate
Yeah.
and it can spread to any other system depending on the patient environment. So this is another thing which I have seen, and people are not aware of what to do regarding after, like as I told, when an immune response is evoked, when they get a flu, when they get a viral infection, naturally there is every reason for them to be scared.
Yeah.
Because they have taken this vaccine and they are prone to get an abnormal immune activity or hypersensitivity.
Yeah.
So what they can do, like in modern medicine, unless and until they get fever or body pain or flu symptoms, there is no flu. Otherwise they will do RT-PCR and check for the presence. But in Ayurveda we have clear-cut symptoms for inflammation. Like it is
Everything is body's response.
body's response, and there are clear-cut symptoms like srodorodha, balabhramsha, sudden loss of strength or abrupt onset of weakness without any reason, gaurava, heaviness, alasya, apakti, malasanga, altered bowel movements, aruji, klama, weakness. All these are explained. So people are to be really cautious regarding these abrupt onset of these symptoms, altered GIT, sometimes constipation, sometimes diarrhea, abrupt weakness. They cannot identify. Till last night they were okay. One morning suddenly weakness is starting, or some body pain is starting, or chest pain is starting. All these requires very close and constant monitoring with aptly initiated scientific strategies, right?
Only
of
way
SBB.
only way to neutralize or only way to resolve this issue is whenever a symptom develops, whenever a complaint develops, whenever a disease develops, it has to be attended very quickly.
Very quickly. Right.
And it has to be managed in the most appropriate manner. Because when fever comes, fever is a response to enhance immune activity.
Right.
When they take paracetamol, it is getting more and more altered. So in such conditions, it can become hazardous at any moment. Or kashtadama, kshipragari dama, or marmobakhadi, it can affect vital organs. Kashtadama, kshiprothana, so it may happen very quickly. Acute onset may happen. So because of this toxin, it can initiate any sort of pathology. So whatever the symptoms, the body gives the clue. We have to adopt the exact treatment and get cured from that disease. That is the best method to get resolved.
So many people ask us how to detoxify COVID vaccine. Definitely there is no direct way to detoxify COVID vaccine. But there is no universal antidote for COVID vaccine. No panchakarma. Panchakarma is not detoxification. It cannot detoxify COVID vaccine or its impact. So what you can do to maximum deactivate the impact of this kind of inflammation. Inflammation is the most deadly thing. Second thing is abnormal immune response can cause cancers also. Nowadays, tumors and cancers are on rise. So what you can do, if you are a sick person, you should immediately try to reverse your diseases. You are having immune dysfunction, allergies, autoimmune conditions, cancers or something else. You have to approach an SBBA practitioner to understand the prospects in SBBA, what all things are possible to reverse your ailments. That is one thing. And if you are a healthy person, what you can do daily, on a daily basis to maximum minimize the impact of this thing is, number one, it is mentioned in our medical science, Ayurvedic science, which is the only science that deals with human being and healing. Only natural science which deals with human being and healing man in his own unique environment.
Natural setting.
So number one, do exercise, correct exercise. Doesn't need to be 1 hour exercise. Maximum do aerobic exercises, not postural ones. Aerobic exercises for 15 minutes, whole body movement, in empty stomach, in a healthy state. If you are having sickness, consult with your SBBA, consult with an SBBA practitioner to know more whether you are fit for exercise or not. 15 minutes morning and 10 minutes evening. You can do any aerobic ones. And number two, boost
that too in empty stomach.
Empty stomach, very important. Yeah. Number two, boost your hunger. Hunger is indicative of immune response. The more you want to improve the efficiency of your immune system, you must wait to get hungry to eat. So you can boost your hunger always. It doesn't mean starving. Okay, both are different. You have to wait till good appetite to eat. That is called boosting hunger. Number three, you have to take medicated ghee. That medicated ghee has to be, it's a medicine. It's not cow's ghee or something. Medicated ghee is decided by an SBBA doctor based on your immune status, metabolism, your existing ailments, your susceptible ailments, etc. So when you undergo that course of treatment also, there are chances of making the immune system healthy and more stabilized.
This is making your body remove all the toxins. Otherwise, we cannot remove the toxins because body is to decide. For that, we have to activate the homeostatic mechanism. For that, exercise, waiting for best hunger and having nourishing food in wholesome,
optimal
nourishing food at right time.
So that's the question. Wholesome, nourishing food, they don't know.
They don't know,
yeah.
And you need to consult an SBBA practitioner.
So please watch our videos regarding what is wholesome nutrition. Yeah. We have made a video on it. It's
wholesome is not
Facebook.
Just the quantity of proteins or carbohydrate or glycemic index or the minerals and other vitamins. So you need to consult SBBA practitioner and ensure that all your disease status is reversed. Once disease start reversing, yeah. You are moving towards health. So health is the only way to prevent all these diseases, all these morbidities and mortalities.
Arogyam ahur bhishajaha sarva badha nivartanam. Sarva badha nivartanam. So arogya or health is the only way to eradicate all sort of diseases. All sort of diseases. Health is the best vaccine. So if you are sick, that is the best time to detoxify your body. You have to undergo SBBA guidelines of nutrition and medication and get rid of your ailments. When you are getting rid of your diseases by undergoing SBBA guidelines, your internal immune system, metabolism, drainage mechanism, circulation, everything is improving in its quality. Thereby, your chances of getting impacted by adverse things in your cells or tissues,
when you are improving your health, then toxins will not be there.
So it will be getting lesser and lesser. Still, some sort of risk is there for sure, but maximally you can reduce the risk in that way.